Thanks very much. I'll just very quickly run through the daily numbers. I know the release has already gone out, but just for the purposes of clarity, there are 11,937 cases of coronavirus in Victoria in a cumulative sense. That's 429 since we last updated you. 416 Victorians are in hospital and 35 of those are in intensive care. I'm very sad to have to report that the total death toll as a result of this pandemic is now 136. That is 13 more Victorians who have passed away because of coronavirus. I'll give you as much detail as I can. One man in his 60s, two men and a woman in their 70s, two men in their 80s, five women and two men in their 90s. 8 of those 13 cases are linked to aged care. We've done 1,676,953 tests, approximately 25,000 yesterday. We're prioritising positive cases, so getting you a total number of negatives will be probably a day or so behind, but it is in the order the labs confirmed for us of around 25,000 tests yesterday. Can I obviously send my best wishes and my sympathies and my condolences to each of the families who have lost a loved one since we last briefed you. This will be an incredibly difficult time for them, and every Victorian is with them. The regional metro split in terms of active cases, there are 6,489 active cases across the state, just under 400, so 386 cases that are confirmed in regional Victoria. Obviously, as more and more data comes in, as more and more of those cases under investigation are confirmed, then chains of transmission and being able to attribute those to a given setting, those numbers always trail. But that is, again, further growth of cases in regional Victoria, which I think confirms the decisions that we made yesterday. Now, given that we are undertaking an exercise that has never been done before, and there is no playbook, no handbook for a global pandemic of this nature, yesterday we made some announcements. Today we'll be able to make some further announcements, but there will be progressive announcements made over the next few days to give people the clarity and the certainty that they need. Whenever you draw a line or whenever you write a list, there will never be complete certainty and clarity about every single item on that list, or there'll always be anomalies of people that are on different sides of any line that you draw. You've got a detailed document in front of you that's a long form list of the decisions that have been made. This list has been the product of a lot of hard work from a lot of people, together with an important process of engagement with the Commonwealth Government, and already to this point, but by no means complete, engagement with given industries and sectors. What I want to try and do today is speak as much about why we're doing this as what we are doing, but to take you through the 3 different categories of workplaces. Yesterday, as I said, was about how we live our lives, so how far we can go from home, the reasons we can leave home, the curfew. Today is about workplaces, and as heartbreaking as it is to close down places of employment, and whilst I never thought that I would be telling people not to go to work, that is what we have to do in order to stop the spread of this wildly infectious virus, this deadly virus. This 6-week period is absolutely critical. We have got to make decisions, very difficult decisions, but we've got to err on the side of doing everything we possibly can to drive these case numbers down, so that at the end of that 6-week period we're not having to contemplate what further steps we might have to take. It is most uncertain about what those steps would be. So what we'll do, I'll go through some examples in each of those 3 settings. I'll describe some of the further work that we're going to be doing throughout the week. I'll also take you through 2 timelines that will relate to different businesses and different sectors. And then I want to make it very clear to you that any clearance or any fact-checking, if you like, for things you're going to publish in papers tomorrow or graphics you're going to put up on the TV, we will do everything we possibly can to support you in that. And what's more, if there's a need for separate briefings to take people through lots of intricate, quite detailed questions, we're more than happy to set those up. They can be completely separate to the daily briefing that I provide each day. So, in essence, there are 3 groups. The first group are those businesses that will remain open and will not be affected. They've already stepped up and are already looking very different to what they ever have in terms of distancing and things of that nature, but This is a really critical list for every Victorian to understand and appreciate. These restrictions apply in the main in metropolitan Melbourne. There are a couple of examples, so you can read everything I'm about to say to be about Metro Melbourne, except I'll point you out a couple of examples where it needs to be statewide. But the group of businesses that will not close, will not change, they will not be modified: supermarkets, grocery stores, bottle shops, pharmacies, petrol stations, banks, news agencies, post offices, plus of course everybody involved in our frontline response, our comprehensive response to this pandemic. That means that people do not need to be going and buying 6 weeks worth of groceries. I understand that there is a sense of concern in the community, and hopefully the clarity of the message today, you do not need to do that, because supermarkets, as well as grocery stores, the local fruit and veg, the local butcher, the baker, all of those shops, they will remain open. And whilst you'll only be able to go to those that are closest to you, and you'll only be able to be one person out of the house doing that for an hour, they will still be open, and they will have, to the best of everyone's ability, they will have the fullest range that they possibly can have. So there's no need for people to be going and literally buying months worth of groceries. Those settings will not close. We are in deep conversation with Coles, Woolworths, Aldi, IGA, all of those companies. We speak with them frequently so that we've got a complete understanding of any of the decisions we make and what the impact would be at that checkout in terms of what it would practically mean for people who are shopping. And we're confident with them remaining open and some of the other decisions we've made, we can still have everything that people need. Whether every single item that you might normally buy will be on the shelves, I can't guarantee that, but there will be everything that is needed, and there's no need for people to go and shop for things in bulk. That sense of panic is simply misplaced. We don't need to do that. That's my reassurance. That's not just from me, but that's from those who run our big supermarkets as well as many other smaller stores. In terms of the second list, which is industries, you've got a long form list, and I don't propose to read through that from start to finish. But there are a number of other industries and sectors that will need to close for that 6-week period. These decisions apply from midnight this coming Wednesday. So we still have time, both the rest of today, and people will be working well into the night, continuing to work through some of the finer details, consulting, discussing, properly understanding from industry what each of these decisions might mean, and things may change in very fine detail. That's the imperfect nature of this process, whether we like that or not. So from 11:59 p.m. this Wednesday, retail will close, some manufacturing will close, some admin will close. These businesses, unless they have specific requirements to safely shut down on a slightly longer timeline, they will have to close by 11:59 on Wednesday night. To give you the retail example, for instance, Bunnings will be, you will no longer be able to go into a Bunnings store, but you will be able to collect goods without making contact with anybody. So some of those drive-through arrangements, similar arrangements for couriering things to you, so the home delivery model will be able to continue in a number of different retail sites, but retail will look very different than it has ever looked. And that's critically important, to have many, many people at home rather than at work and moving to and from work each and every day. In terms of the third category of businesses that will have to scale back the way in which they work, they will remain open, but they will look very different, and they will be operating at a significantly reduced capacity to what a normal August and September would look like. If I can give you a couple of examples. Firstly, meatworks. We know that meatworks are a really significant challenge for us. Whether it be lamb, poultry or beef, they will move to 2/3 production, so they will reduce their production by 1/3, and those workplaces will look very different. There will be some of the most stringent safety protocols that have ever been put in place in any industrial setting. Those workers will be essentially dressed as if they were a health worker, gloves and gowns, masks and shields, They'll be working in one workplace only. They will be temperature checked. They will be tested. It is a proportionate response to the risks that industry poses, but given the critical part in keeping Victorians fed, and indeed the nation fed, given that so much activity hubs out of Victoria, particularly given the drought and other challenges in other parts of the country, it is not possible to go below that 2/3 level. So cutting production by 1/3, we still believe that people will be able to have access to the products they need. Again, I can't guarantee that every single product at exactly the volumes that you might like to buy will be there, but there'll be enough for people to get what they need. Not necessarily what they want, but get what they need. Those changes will come into effect, together with a couple of other examples which I'll move to in a moment, on midnight Friday. I would simply say to people, again, butcher shops remain open, boning rooms remain open, abattoirs remain open, meat processing centres remain open. They'll be open at a lower level, but after deep consultation with industry, we still believe, given that this is for many a less busy time than it would otherwise be. If we were in a few months on right into spring, then that would be a very different set of circumstances. I can't guarantee that everybody will get every product they want in the quantities they'd want, but everything you need will be there, and there is no need to be doing anything else other than buying the things that you need when you need them, and of course following the rules as you do so. In terms of other sectors that will scale back but not fully close, construction, which in many respects is the lifeblood of the Victorian economy. If I can divide that sector into three parts, very large-scale major projects that the government is involved in, they've already been reduced in terms of workforce in a global sense by about half. We will continue project by project to look at ways we can further reduce the number of staff whilst doing so safely, and whilst, for instance, allowing us to reopen train lines that are currently closed because we're removing level crossings. That's a logical way to go. In terms of very large commercial building, whether it be building apartments in the city or building factories or warehouses or some of those sorts of non-residential building projects, if it's above 3 stories, then those builders will need to reduce their workforce down to the practical minimum, but they can have no more than 25% of their workforce working. In terms of the third category of building, which is domestic homes, that sector can obviously stay open, as the other two can as well, but it will be unlawful to have any more than 5 people on site at any one time. That means essentially for some of these industries we are moving them to a pilot light phase. They're not being turned off completely, but they are dramatically reducing the number of people that they have working for them and their output over these next 6 weeks. That is a very difficult decision to make, very challenging decision to make, and I know that there will be substantial pain that comes from that. But unless we have literally hundreds and hundreds of thousands of people at home and not going to work, so hundreds of thousands less movements around the community each and every day, then we will not pull this virus up. We will not see those numbers reduce. Throughout all of this, we have tried to be as logical as possible, to understand quite intricate and detailed supply chains, and to be aware of all the consequences of each of the decisions that we make. The reason there is lead-in time, today we're announcing things that don't come into effect until midnight Wednesday. Today we're announcing things that won't be fully implemented until the end of midnight Friday. To go alongside particularly that second category, whether it be construction, meat processing, or other scaled-back industries, there will be COVID-safe plans for all workplaces, and particularly those that are at a higher risk. It'll involve things like testing and temperature checking, some of the PPE issues that I talked about, particularly in the meat industry. All of that will be challenging, all of that will be very difficult, but it is what is necessary. These are the decisions that I've made because they are the decisions that will keep us safe and drive down case numbers, so that at the end of 6 weeks, we have every chance of having got this back under control and we're not having to then countenance even further action, the damage from which would be altogether well, it would be in another category. It would go even beyond this, because it wouldn't just be changing how the economy works, it would be very much changing the way that we live our lives even further. We don't want to get to that point. We want this strategy to work, and to do that, we've got to make tough decisions, but we've also got to appeal to all Victorians to work with us to make these decisions work, to make this strategy work, and that means compliance, it means doing the right thing, it means playing your part, and it means making the best of very bad circumstances, making the best of really challenging circumstances. Now, everything I've announced relates to metropolitan Melbourne with the exception of abattoirs. Those rules, so 2/3 production, PPE, much like a health setting, as well as temperature checking and stopping workers working at multiple sites, all of that will apply at each of those important facilities right across the state. We can't have a situation where such a high-risk environment is operating under two different sets of rules in two different parts of the state. That will only contribute to further outbreaks and would only mean we were moving the problem from where it currently is into communities where it hasn't been yet. Now, in terms of support for business, and then we're happy, I might ask Brett actually just to add to my comments, and then we're happy to take any questions you have. We know and understand that whether it be in regional Victoria going into stage 3 from midnight Wednesday, or the other announcements I've made today as reflected in the long list that you've been given, there will be very significant pain. I can announce today that all of those businesses that are forced to close, so restaurants, cafes, beauty, gyms, all of those in regional Victoria as part of the imposition of stage 3 will be eligible for a $5,000 grant from our government, and we will do our best, our very best, to get those paid as quickly as we possibly can. Same criteria as applied last time, where we had the best part of $850, $900 million worth of those payments were made out at another point. In terms of metropolitan Melbourne and Mitchell Shire, you would be aware that we're currently in the process of paying out literally thousands of $5,000 grants. I can announce today that we will add a further $5,000 to those grants, acknowledging that they will have been under these restrictions now for a period significantly longer than the first 6 weeks as foreshadowed. So that will mean 10,000, and indeed for those metropolitan businesses it'll finish up being in aggregate terms, first and second wave, payments in the order of $20,000, together with a number of other waivers of taxes and charges, and indeed for some businesses, indeed many businesses, all of those really significant payroll tax refunds, where we were able to return to those businesses monies, 3 quarterly payments that they had made to us prior to the first wave. That package is in the order of about $600 million. We'll have more to say about business support. We'll have more to say about our work with the Commonwealth in due course. Just before I do ask Brett to say a few words, can I just confirm for everybody that I've had a couple of very good discussions with the Prime Minister today. We are working very closely together. I'm very grateful to his officials, whether it be at an industry level or in terms of the Department of Prime Minister and Cabinet, his public health team as well. We're all working together to make sure that these very difficult decisions are made as best they can be. There will be questions, there will be anomalies, there will be things that we need to tidy up and deal with over the coming days. That is the nature of such significant choices, really difficult choices, and in many respects something that is completely unique. That's why we've got that lead in time, and it's why there is literally dozens and dozens of people speaking to people across literally every industry in the state to make sure that we're fully aware of the consequences of the decisions we make. There is no alternative but to follow the rules. There is no alternative but to get tested if you have even the mildest of symptoms. There is no alternative but to stay at home if you are waiting for a test result, or if you have the virus and have been told to stay at home. That's absolutely critical. Every Victorian is making enormous sacrifices. I'm so proud and grateful of all those Victorians who are doing the right thing. To those who aren't, you've just got to make better choices, and I'll have more to say tomorrow about significant boosts in penalties, significant boosts in enforcement, and again, I'm very grateful to the Prime Minister for the partnership that he and I have, because tomorrow's announcements around some of those issues will involve further ADF, further important support for us to get this job done. These are not easy decisions. This is a very tough day, and there are many more of those to come before we get to the other side of this. But these are the decisions that have to be made. That's why I've made them. We have a plan, we have a clear strategy. It'll only work though if everybody plays their part, and I'm deeply grateful to every Victorian who is. I'll now ask the Chief Health Officer to add to my comments, and then of course we're happy to take any questions that you have.
Thank you, Premier. These are indeed very substantial restrictions that will be coming into force. We should reflect on the fact that stage 3 restrictions did make a difference. They genuinely flattened the curve, but they flattened the curve to a point where we got to a plateau of 400 or 500 cases every day. That would have continued indefinitely because if you're really only driving transmission down to a level where one person infects one other individual, then you've got 400 or 500 cases every day ongoing. It may even have been just above 1 or just below 1. But either way, that means you've got hundreds of cases going into next month and the month after and the month after. These restrictions are very substantial, and I absolutely expect, that we'll see transmission driven down and cases to decrease over time. We don't see it in the numbers instantaneously. We'll see the effect of universal mask wearing in the numbers in the week ahead and ongoing. We'll see the effect of these restrictions in the following week, but they will be ongoing and they will continue right through the 6-week period where we'll see a reduction in numbers week on week, as long as people are following the directions that have been laid out. Obviously, there are some constraints that have been set in stone in a way. They will make a huge difference because there are literally limited opportunities to transmit the virus in the workplace, in other indoor settings as people go about their essential business, and even in the additional limitations in who will visit your household. So they're all downward pressures on transmission of this virus very broadly across society. And so we can expect that numbers will improve week on week, but they will improve to the extent that we follow the advice, because it's not just the opportunities for transmission, it's also what a potentially infected individual does. So isolating right from the beginning of having symptoms, getting that test, and having those close contacts quarantine are also really critical elements that we'll need to keep on right through this period. But there is an absolute expectation that this will do the right thing and will drive numbers down as people follow the directions. Thank you.
Happy to take any questions you have.
How many workers are affected by it?
Around 250,000. So just to put that into some context, and this speaks directly to why these changes are so important. We estimate we've got about 500,000 people who are working from home. We know that there's about 250,000 people that have been stood down in one form or another, and this will add a further 250,000 in rough numbers. We'll get a clearer sense of that as the week unfolds. But that is essentially 1 million workers who are not travelling to and from work every day. When you add in 1 million students together with teachers and staff, that's when you are radically, dramatically changing the number of people moving around the community, and therefore the number of points at which the virus can be transmitted from one person to another. And again, it directly relates to those mystery cases, those community transmission cases where we just can't determine where the person got it and in what circumstances. I've had a conversation, as I said, number of conversations, in fact, with the Prime Minister, JobKeeper and JobSeeker, and some other arrangements, particularly for those who are in insecure work. I look forward to the Prime Minister making some further announcements, particularly in relation to that last category of worker. But JobKeeper and JobSeeker are at the higher level, the higher rate, until well into September, so well past this 6-week window. And I'll continue my discussions around cash flow support, business support, other things we can do in partnership. The Prime Minister has sought from me a commitment that it'll be a joint effort. And I've given him that commitment, and I make that commitment to every single Victorian, that we will work together in partnership with the Commonwealth to look after those who need to be looked after, to support those who need support, and then to get right into that rebuilding work that will be necessary once we get to the other side of this.
What impact will this have on the economy, Premier?
Well, this will have a very significant impact, but until we fix the health problem, until we get these case numbers down to a much, much lower level, then we simply cannot open the economy up again. So there is significant damage that needs to be done here, but there is no choice but to do that damage to fix the health problem and then be able to move then to rebuilding the economy. Now, we know that there will be, that damage is not just in dollars and cents. That damage will present in lots of different ways, and that's why throughout this week I'll have more to say around support for those who are living with family violence, those who have got significant mental health issues, and those who are experiencing anxiety and depression and many of the attendant challenges of this really difficult set of circumstances. We'll have more to say about those measures throughout the course of this week.
Can you even people who have lost their jobs or are about to lose their jobs as a result of this decision?
Sorry, I didn't get the first part of it.
People who have lost their jobs or are about to lose their jobs as a result.
Well, these are heartbreaking decisions, but there is simply no choice. The advice from our medical experts is that this is the only way to get these numbers under control, to drive them down low enough so that we can open up again. The alternative is a 6-month strategy, not a 6-week strategy, and then even at that point, significant doubt that that would work. We cannot continue to have 400 and 500 cases a day and so many people in hospital, so many people dying. We've got to drive these numbers down, and if we continue to have the sort of movement that across the community, across the economy, as is part of stage 3, if we don't move to the further restrictions I've announced today, then we simply won't drive those numbers down. That strategy has avoided our hospitals being completely overrun and many, many thousands of cases each day. But that stability is not enough. We need to drive these numbers down, and as Professor Sutton has just indicated, instead of every positive person infecting another person, only every second or third or fourth person who gets the virus passing it on to someone else. That's what these restrictions are all about. It's heartbreaking, it's very challenging, but these are the tough calls that have to be made. Otherwise, we're not in for a 6-week set of restrictions. We're in for a 6-month strategy that I don't think will work.
But you can't begin to estimate the human toll, can you, Premier?
No, it's very challenging. It is very, very challenging, and no one enjoys having to make these important decisions. It is heartbreaking, it is very challenging. There will be a lot of support that is required, and we will be there to provide that support, to stand with everybody who needs that support, whether it be economic and financial, whether it be care, comfort, and the kind of welfare support that we need to provide. We have done that throughout. If we have to double our efforts and double them again, then we will. We're all in this together, and we all have to look out for each other, and the government knows it's the important part that we play in that. And I'm very pleased to say that there's an acknowledgement that whilst this is a challenge in Victoria, it is a challenge nationally as well. And that's why the national government and our government are working so closely. So yesterday I made some announcements about Night Network that will no longer run, and post-curfew public transport services will be dramatically reduced. We still need to have some services there because we've got some people who are still working, whether it be in our health system or in other industries, but it will be a significantly reduced timetable. So a number of services will be cancelled, and that's a reflection as well of having less people moving around the community, there being less demand for those services, but it's also about being able to redeploy staff, particularly protective service officers, to the enforcement of the curfew and the enforcement of all the other rules that we announced yesterday. Sure. Are you talking about significant civil construction, Rich, or yeah? Well, what we're doing, they're going back to pilot-light levels of activity. They're not being turned off, but they are just going to be sustained for that 6-week period. When you think about this, and there's been a lot of consultation, a lot of work with those businesses, with unions, to properly understand this. If you were to say complete shutdown, then it may take several weeks to make a site safe, to board it up, as it were. Then there'd be a couple of weeks when they were shut, and then there would be another couple of weeks required to open back up again. That won't achieve what we need to achieve. We need to dramatically reduce the number of people that are moving in the community. We think that as a maximum, 25%, and then the safest practical number, that's where we want to get to, but it cannot exceed more than 25%. We think that that is workable. It's not pleasant. It's no one will enjoy that, but it is doable. And we think the reward for that effort, the dividend in terms of dealing with the risk of the spread of this virus, justifies us doing that. Similarly, on volume building, so building homes out in the suburbs or wherever it might be, they're obviously much smaller scale. A lot of that work is indeed outdoors, but at the same time, it's a big part. It's a very significant part of the economy, and we think we can, by going down to that 5 people at any one time, that'll mean that the house gets built more slowly. It'll mean that the plasterers are in there, but the electricians aren't. The painters are in there, but the other teams of tradespeople aren't. But it'll still be able to trickle along for this 6-week period. So wherever we've been able to do that, they're the decisions we've made. In terms of warehouses, very large distribution centres as well, that's the other example, which I think is in some of the material that you've got around scaling back. That'll mean that some parcels will arrive not quite as quickly as they otherwise would have, but they will still get there. There's a very large degree of automation in some of these places. They are a riskier environment than others. So that, again, there'll be specific, higher level, next level in many respects, unique safety measures that are put in place in those workplaces also.
Why is horse racing and greyhound racing being allowed?
It continues because obviously it's a very low risk activity. What's more, there are changes though. There'll be no owners, there'll be no media, there'll be only the broadcasters and the direct participants involved in that activity. There are some significant animal welfare issues. If you were to try to turn that industry off and take those animals out of training, there are some very significant animal welfare challenges there. So we've found it's a compromise. I'm sure many in that industry will not be pleased that there's further. It's been scaled back further, but we think we've struck the right balance there.
From just on having tradies to your house, are you allowed to say have a cleaner come over to your house?
No. There'll be no cleaners going to your house. There'll be no one mowing your lawns. There'll be no one providing anything other than emergency support. So if you need a plumber because a pipe has burst, then yes, you can have that plumber come and do that work. But it's not the time to be painting your house. It's not the time to be having completely unnecessary tradespeople right at this time. They're critical in terms of the economy, but the work is not necessary and urgent. It cannot happen. Now that should not be read. Meals on Wheels, home and community care, other important services that are very much about the person's welfare and well-being, they will be able to continue. But of course, the PPE protocols that are in place now obviously will they'll endure there. If you have, we're going to do some further work on this because this is a question that's been raised. So we've got a treatment for a number of, we've got an approach to a number of transactions that are already in train. So for goods that are going to be delivered, things that are planned to happen. I don't want to see people not able to settle on their home. I don't want to see people who are supposed to move from one place to another because the lease has run out, unable to do so. We're going to get some specific advice on that. We've already given it a fair bit of thought, and I think the answer will be yes. If you've got a contract, if you've got an arrangement in place, then we will allow you to fulfil that. But again, it needs to be, and this gets back to the personal choices that each of us make. There will be instances where we'll make a ruling. There'll be other instances where there'll be a bit of discretion and people will have to make their own judgments. And I'd ask people to make the judgment that best supports not spreading this virus, not the judgment that might be convenient, but deep down is actually running a risk. If we all want to be past this, then we've all got to make, sadly, a very significant contribution to this effort.
You talk about $5,000 for some of those small businesses that are being affected. Will there
Yes.
be any financial assistance for, say, big warehouses, manufacturing factories, and construction sites that have to scale down?
Certainly don't rule out providing further support. We have, for instance, provided a mixture of different support, not so much stimulus, it's much more about cash flow. And each of those different commitments, so whether it's waiving we've waived taxes, we've deferred taxes, we've refunded taxes for some larger businesses. everything down to refunding liquor licence payments that a number of licensed premises had already paid. We have given out cash grants to businesses. I'm not expecting, those businesses will be bitterly disappointed to find themselves in this position, as am I, but we'll keep providing what we can afford to provide, and I wouldn't rule out providing further support in terms of cash flow support, and I think the Commonwealth, our discussions with the Commonwealth will be very important there too. That ought to be, and I'm confident it will be, a shared effort between our government and the Commonwealth government. That'll mean we can get the most impact for any additional monies beyond the announcements I've made today that we commit to. Beyond that though, when it comes to stimulus and if you like, making sure that these businesses have got an order book for the future, well, the government will have a really significant part to play in that. And I just remind you, we've got hundreds and hundreds of smaller projects, $2.7 billion worth, that we committed to a couple of months ago. And late last week I had an update on all of those, and they are progressing very well. And there will be, once we get into September, there will be significant opportunities for businesses large and small, but particularly smaller businesses, trades and others, to really push on with that work. That'll be even more important than it is right now.
Does sole traders qualify for the $5,000 payment?
Pardon?
Does sole traders qualify for the $5,000?
The same eligibility criteria applies as had applied under our first $10,000 grants. I would just point out, and we'll have more to say about this in coming days, there are a number of different groups that are disproportionately negatively impacted, and we have had some very targeted assistance for those, whether it be arts and entertainment, where I know there are a number of those sole traders that you refer to. Hospitality there's been different packages within that industry, CBD for instance, and then there were packages for tourism operators. I don't rule out having further targeted packages of cash flow support and other support beyond that.
Premier, how much were your restrictions based on what New Zealand did?
No, this is a uniquely Australian and Victorian approach. If you look at what New Zealand did, they went a fair bit further than this, and yeah, look, I'm not here to run a commentary on what other countries or other states have done. We've designed something that we think will work here in Victoria given the circumstances that we face, and we've also had some really meaningful discussions with the Commonwealth Government as well to make sure that there was nothing that we didn't have line of sight of that we needed to. And obviously when you're talking about supply chains that don't just run within Victoria, they're into our region, so into Southeast Asia for instance, and indeed supply chains that run all the way across the country, that detailed engagement with the Commonwealth was really important, and I'm deeply grateful to many officials for whom the last few days have been very long days.
Will you need to extend the eviction ban, Premier?
Sorry?
Will you need to extend the eviction ban, and do you have a message for the banks that are going to be under more restraint?
In terms of the changes that we had made to residential and commercial tenancies, we'll have more to say about that quite soon. In terms of the banks, it's not often that I've stood here or many places at all and said good things about the banks, but I think that many financial institutions, our banks have stood up and have by and large done very important work, very good work to support people with mortgages whose circumstances could not have reasonably been foreseen, are in very difficult circumstances, and they've done their best. I think, at least that's the feedback that I get. They've done their very best to try and accommodate that with deferrals and other things. So I'd encourage them to keep going the way they have, because I think that customers are obviously very grateful for that.
Premier, you just come up with a list again of what is a priority worker, the terms of sole
No, we'll have some more to say about that, and that's why. Look, in some respects you'd like to do this and you'd like to have it all come into effect immediately, but the number of unintended consequences that would come out of that means the best approach is to step this out. So we had some things that came into force at 6 p.m. last night and at 8 p.m. last night. We have some things I've talked about today that will come into effect from midnight Wednesday night, and others that will be finalised by the end of Friday. I'll have some more to say about those issues of childcare and school, but in broad terms, only those who are still working will be able to send their kids to school. This is in metropolitan Melbourne. Send their kids to school to have them learn remotely with a teacher or staff member supervising them. Now let me explain why that is different. That will mean less kids are at school. Now the reason for that, and we will have more detail about this and give parents as much notice as we can, and of course the school arrangements don't come into effect for another couple of days. What we need to do is across the board have less people going to work, less people moving around the community. And what I can't have is to have more teachers, more staff, more students and parents moving around the community than is absolutely necessary. And I know that will be incredibly challenging for a number of people who perhaps are working from home, but there's simply no choice. We've all got to make a contribution to less movement rather than more, less spread of this virus rather than more. And that's why we're putting some of these industries on a pilot light setting, if you like. They'll sit there and be able to reboot in 6 weeks' time. Other industries are being scaled down, not quite so much because they're part of an essential food supply chain. Other industries are closed all together, and that is very, very challenging. But it is exactly what we need to do in order to drive these numbers down. We can't, any of us, pretend that if we didn't make the tough calls, if we said, look, this is too difficult, we're going to leave all these industries open, we're going to have hundreds of thousands of extra people at work as opposed to what we've announced here, that will drive these numbers down. We simply won't. They will hover at 500 a day. The deaths will continue to go up, the number of hospitalisations will continue to go up, and at some point, no system can cope with 500 cases a day. And it then becomes akin to having thousands of cases a day over a much shorter period. We cannot do a 6-month strategy on this in the hope that it might work with tiny gradual decreases each couple of days. We have to do something that is very painful but will drive these numbers down and drive them down as quickly as possible.
Premier, a high proportion of Victoria's cases are in industries that are going to continue to operate, albeit with restrictions. How confident are you that these measures will bring the cases down to the levels we need them to be down to?
Well, we're as confident as we can be, knowing that there are many variables here. But I think, Rachel, if you look at meatworks, I don't think that anyone would ever have thought that someone who's working in a meatworks on a line would essentially be wearing head to toe the same gear that our hospital staff wear when they are treating COVID positive patients. That's the sort of level of PPE that we have to get to. We are reducing their overall production by a third. That is very, very significant. If we don't see compliance, if we don't see people in that industry doing the right thing, well, I'll have no choice but to go further. But in the discussions we've had, and there have been many, we think that we have a strong partnership with this industry, and they will step up and do even more. But they'll do less work, but they'll do even more in terms of making a contribution to their workplaces being as safe as possible. The alternative, of course, is to have mass food shortages. And I think we have to try and avoid that wherever we can. I just go back to the central point. You may not be able to buy every single item that you want in the quantities you normally would, but people will have everything they need. People will have everything they need, and there'll be more to go around if people buy what they need when they need it, rather than going and buying 4 trolleys worth of groceries and enough chicken or beef to last you until Christmas. That's not necessary. That is simply not necessary. And that's why I think you'll find that a number of our supermarkets will add to some of the restrictions they've already put in place, and I fully support them doing that.
How long do you expect the economic effect of this 6-week restriction to last on the Victorian national economy?
Well, I'll leave the national economic analysis to others. In terms of the Victorian economy, I would see it as not just a 6-week issue. I'd see this as the entire impact of this pandemic, which is now months old, will take us years to recover from. There's simply no doubt about that. And that's why a clear plan to rebuild, to recover with strength, a clear plan around skills and jobs will be absolutely essential. And we've already begun the hard work of drawing that plan up, and we will waste no time delivering it and delivering it in full.
How are you going to ensure that businesses are doing the right thing? Are they going to be fully
I'll have some more to say about an increased, very significant enhancements to our door knocking effort, particularly for positive cases and close contacts. I'll have more announcements to make as well about compliance in a broader sense, and I'll have some announcements tomorrow about penalties, where people are just, totally unacceptable behaviour, doing the wrong thing. It isn't good enough for us just to get angry. We need to take steps, and we need to send very, very strong messages. We have been, but we're going to go a step further. But I'll have more to say about that tomorrow.
I think you're aware there's already been a lag on the payments going out, payments that you promised to businesses first time around, and now you're obviously offering more. Is there anything that can be done to speed up that process?
There are literally tens of thousands of payments. I'm happy to come back and get you the exact data, but we paid out, I think if memory serves, and I'll be happy to give you the exact figure later on, but I think we're in the order of $800-900 million the first time round. Many thousands tens of thousands of businesses. Any system will always struggle to pay out that much money to that many different applications. There'll always be some time involved, but of course we're looking at our systems across the board, and where we can make any improvements, of course, James, we will.
I just have a question for Brett.
Certainly.
What the curfew stop from happening? Is that about trying to stop parties and family gathering?
Yeah, presumably it was part of the state of disaster announcements, and it was with a view on police being able to see the movement of people after that 8 p.m. time. So clearly they're able to focus on a smaller number of people, and they can have greater oversight and compliance and enforcement for those who are seen to be out after 8 p.m. And so they'll be able to really dig down into the essential reasons that people will need to be out of home, and it'll crack down on those individuals who are moving for non-essential reasons, who might be visiting other homes, who might be visiting other people for non-essential reasons. And those non-essential visits are exactly the interactions that are contributing to transmission in Victoria.
Brett, how long, how many weeks should it take before we start seeing infections start to come to fruition?
Yeah, I think over the next 10 to 14 days, we should see the effects of these restrictions show in the numbers. As I say, there might be some effects on the mask wearing that has already been in place for some time that we'll see in the coming week. But the real driving down of transmission from these restrictions happen a week to 2 weeks after they're implemented. So, curfew, Wednesday nights restrictions, and then Friday nights all showing up 7 to 14 days afterwards.
Parents with
6,500
young children
active.
are now often being faced with the choice between exercising themselves or going out with fresh air with their kids to get some fresh air. Are you concerned that there might be some unintended mental health and physical health consequences from that, and would you consider making an exemption for parents with young kids?
So parents can go out with their families, obviously, for the purpose of exercise if there's no other option of having those kids at home. But there's no escaping the impact on people's mental health and the psychological challenge of what a lockdown means. That's why there will be further announcements, as the Premier's intimated, in relation to that support. But these are inescapable realities. We have to limit our interaction with other people in order to stop transmission, and that has an effect on what amounts to human needs. We all struggle not to see our extended family members, not to see some other friends and supports that would normally be available to us. That's an inescapable and really difficult issue, but we're trying to strike a balance here to minimise transmission, but to allow people to have the interactions that are necessary to support them.
Given we've got almost 6,500 active cases now, is it realistic that in 6 weeks' time we'll have a negligible number?
I think in terms of new cases emerging, we can drive those numbers down very substantially. There will be a lag in terms of active cases because people obviously can be infectious, for 10 days. But there is real confidence, and it's not just my view. This is coming from the public health team that supports me, and it's AHPPC's view. The National committee of chief health officers. They are in support of this approach by Victoria. They think it'll work, and they absolutely think it's necessary. But to your point, I think we can drive down to a point where we've got very minimal new cases, but there will be, thousands of active cases over that period of time that will come down more slowly because people obviously have to recover, including hospitalised patients who might be in hospital for a matter of weeks. So, those active cases will persist for some time, but it's the new cases that we'll be watching on a day-to-day basis.
The mystery cases jumped dramatically. Was that just a question of you had to rule a line under a lot of them that you investigated and that was it?
Yeah, that's right. So the mystery cases get finally classified as mystery when you've looked into every possible potential acquisition for those cases. So when you've determined that they're not linked to any existing outbreak, any existing cluster, that they don't have a link to any existing active case, confirmed coronavirus case, then you can determine that it's a mystery case or a community transmission case. So it is part of closing off that investigation.
Has the app actually proven useful in solving any of those mystery cases?
So the app essentially will rule out a mystery case if it can identify a contact who's already flagged as positive. But the real benefit of the app is when you're confirmed as a positive case and all of your close contacts that you haven't been able to name get flagged through that app.
So has it actually proven have you actually been able to identify anyone?
As I've said before, we're in a setting in Victoria where the policies are that you're not going to be in a pub with several other people. You're not going to be in a setting where there are dozens of people around you who aren't familiar to you. We've got policy settings where almost everyone that you're going to be in close contact with, you can identify as a close contact in the workplace, in your home, or going out for essential reasons. So now in Victoria is not a time where the app comes into its best use, but we've seen in New South Wales that it has had a significant effect because they've got policy settings where people are becoming positive cases where there are a number of people around them who they can't name and who don't normally know. So the app is most useful in those circumstances, and for that reason I'd encourage people to have it, because we'll get to a point where we're opening up, where we'll be mixing with a great number of people again, and if there are positive cases, then we'll want that app to be able to identify their close contacts.
Is this our last resort? Is there another queue we can go to if this doesn't work?
This is really a significant effort, a significant step up from stage 3, where we absolutely have to have everyone doing the right thing to drive numbers down. There aren't really many other settings that you can go to. But we've seen it work across the world. We know it's more challenging in a second wave, but we've seen it work and it will work.
Should we have done this earlier, Brett?
I think in retrospect, it's always difficult to know, when you hit the button on an intervention like this, especially with such significant impacts. But with the wisdom of hindsight, it would be great to know that the trajectory that we were on was always going to go the way that it was going to go. I wish that we'd never gotten to a point where we needed to intervene in this way. And so a lot of the decision making was around trying to see the effective interventions, but you never know exactly how those interventions will work when you bring them into play. So it's a really tricky space to make decisions in, and you're trying to avoid the harms of exactly what we're doing now. But you're balancing that with the need to drive transmission down.
Professor Sutton, the MIP release does flag a stage 5. It says it's hard to imagine what a stage 5 might look like, but it would radically change the way people would live. Do you have to elaborate or tell us a bit more about
No, we're not thinking about a stage 5. We are thinking about a successful stage 4. We know it can work, but it does require, and this is what talking about a stage 5 is, it does require everyone's cooperation. Because it mentions it because it's saying that the alternative is inconceivable. We need everyone to do what's required now in order to get to where we want to be.
How many clinical
There are literally thousands on the phone who are chasing up close contacts and who are talking to them about what quarantine requires of them, and who are checking in to make sure that they haven't developed symptoms, don't need a prompt to get tested.
Premier, you mentioned a couple of times shared responsibility with the federal government when it comes to the finances of this. There's been some commentary, speculation that you might match them dollar for dollar on the compensation aspects of what's required here. Is that correct?
No. What I'd say to you is each and every thing that we do, each and every decision that we make, an announcement that we make, should be looked at on its merits. I've had some discussions today with the Commonwealth Government that are about a shared approach in relation to insecure work. It won't necessarily be dollar for dollar, but there are some cohorts of people, some groups of people that are not covered under various federal government arrangements. We have covered them, and we will continue to. So I would hope that no one should read into that that we are anything other than unified and working together. We absolutely are. I'm not quite sure how many conversations I've had with the Prime Minister over the last 3 or 4 days. Lots, and they've all been productive. They're all about outcomes, and I'm very grateful for his support. And very grateful for the practical way in which he approaches this. We've all just got to get the job done. That's my approach, always has been, and I'm very pleased to be joined in that by the PM.
Just something else that arose out of yesterday,
Sure.
specific to childcare and the finances of childcare. I know
Yes.
that's as well, but are you aware of any plans so that parents won't have to keep paying to keep the child's
Yeah.
place? And what about the workers?
It is a very significant issue, and as you rightly point out, that's not one that's that I can make announcements about. But the Prime Minister and Minister Tehan, I think, in some comments he made yesterday, there is an acknowledgement, and I suppose in many respects it's not just about attitude or any comments that are made now. The runs are on the board, if you like, in that there was a direct intervention by the Commonwealth Government to support this sector, and I know there are lots of different discussions going on about that, but they're not matters for me to announce. They're indeed a matter for the federal government.
Can babysitting go ahead? Can people have babysitters around to their house or grandparents, aunties, uncles babysit their kids?
I think you need to have the minimum number of people coming to your house under any circumstances. Under any circumstances. That is the most. Brett can speak to this, but you've just in every way you've got to be limiting the number of people that come to your home, and you should ideally have no one coming to your home.
No, of course, but if you're an essential worker and you need
Yeah,
to go to work and you don't want to...
Well, childcare will be... Well, childcare will...
If you don't want to take your child to childcare, for example, you
Well,
it's a safe setting for your child.
I'll let Brett speak to that.
These are being written up in the legal directions as we speak, but the intent is yes, for those who haven't got an option perhaps for formal childcare, that if they need care at their home because they're essential workers and they need to be at that workplace, then that'll be available to them.
And will there be a list of essential workers? It may be in the documents we've got, but will there be a list of what's classified as essential workers?
Yeah. What we will... Sorry, someone almost asked this before, or they did and I didn't answer it. Let me just make the point. We'll have some more announcements to make this week about a permit system where people will have a piece of paper that says, this is where I work, this is what I do, so that for the purposes of enforcement, curfew, all of those things, we don't want to be putting people into that really challenging situation where they have to explain themselves even though they don't really need to. But that's going to be a simple, common sense process, and we'll have more to say about that soon. As it is now, the curfew obviously does apply, 8 p.m. to 5 a.m. every day. If giving care, getting care, or going to and from work, or being at work, they're the only reasons to be out. Police will be stopping you. They will be asking those questions. They'll do it respectfully, and they'll be very fair in these early days, in that they'll probably err on the side of, it is early, but the time will come when that gets turned off, and anyone who's stopped and doesn't have a lawful reason will get fined. In terms of permits and that broader issue, I'll have more to say about that soon.
How did the curfew go last time? Did you hear this?
My reports were very early on this morning, so I haven't got a full breakdown, but I'd leave it to Victoria Police to update you on that. I will confess that I've been a bit tied up on other things, but the curfew's there. It's there for a reason. It's there to protect all of us, and you just can't be going out at 9 o'clock at night to a mate's place. Oh, no one will know. I won't get caught. You will get caught. You will be caught because what you're doing is you are contributing to the spreading of this virus, and you're meaning that everyone else stays in lockdown for longer than they should. Those choices have got to stop. That activity has got to stop. And Victoria Police, as I've said a few times now, and the fine data backs me up, they are not mucking about. They will continue to do what has to be done.
How many hospitals now have active outbreaks among healthcare workers?
I'd need to come back to you in terms of individual settings, but obviously we have in total numbers, we have, I'm not sure if I went to this before, but we have 1,089 active cases that have got a connection to aged care, and we've got about 706 active cases amongst health workers. Be a little bit double up with that, but it's a significant issue. And again, I know I've made this point a few times, and obviously we're happy to answer any other questions you have, but if we were to end on this point, it wouldn't be the worst place to end. Let's be clear. Our health workers put themselves in harm's way every minute of every shift in every setting. If you value them, if you respect them, if you honour them, then don't do anything to contribute to the spreading of this virus. Instead, help them in the work that they do. Make sure they've got less patients that need a machine to help them breathe. Make sure that there's less opportunity for those health workers to become sick because they're tending to the sick. This is a really simple thing, but to avoid a fine, to get this over sooner than it would otherwise be, to support our health workers, to keep yourself and your family and every family safe. You've got to follow the rules, you've got to do the right thing. And just because, for instance, babysitters might be allowed in very certain circumstances, that's not an invitation to do that. The fact that there's an hour's exercise and there's an hour's shopping a day, there's an hour's exercise and there's an opportunity to go shopping each day, doesn't mean you should go shopping each day, every single day. You should be out doing what you need to do when you need to. And they're the sacrifices, large and small. There's enough people making really large sacrifices. There's not too much to ask the rest of the community to do those small things that in total, in aggregate, they make a really big difference. At the same time, as stern as we sometimes have to be, as frank and as absolutely direct as we have to be, I wouldn't want the bad choices made by a minority to detract from the amazing work that so many Victorians, a vast majority of Victorians, are doing. I'm deeply grateful to each and every one of you. I'm proud of you. We will get through this. We'll get through it if we stick together. We'll get through it if we follow the rules. We'll get through it if we make the tough calls when they need to be made, and that's what I've done yesterday, that's what I've done today, it's what I've tried to do all the way through this. But me and my team, it's thousands big, thousands of people, but we can't do this on our own. We need every Victorian to play their part, and that's why I'm so grateful to all of those who are. Any other issues?
Sorry, can I just ask, can Melbourne workers continue to travel to regional Victoria?
If you are working in a permitted industry, then yes. And the reason for that, if I was to, this is something we did give quite a bit of thought to. If I was to say no, you can't, then what I'll finish up with is nurses, for instance, who travel a bit north to go and work at a hospital. You'd also finish up with vice versa, people that wouldn't be coming to Melbourne. We've already seen, for instance, because the border with New South Wales is closed, a number of hospitals in the northeast of Victoria where staff live on the border, so just into New South Wales. We don't want to see the same sort of impacts happening on that border between regional Victoria and Metro Melbourne. However, regardless of the setting, regardless of the job you do, no one can go to work if you've got even the mildest of symptoms. And I would appeal to anyone in Melbourne who is in one of these industries that's remained open or is scaled back, who needs to go to work, and they're doing very important work. But the last thing you want to be doing is taking this virus to work with you into regional Victoria. So any symptoms whatsoever, the only thing to do is to get tested and then to wait until you get the results of those tests.
Premier, sorry, I asked Brett
That's all right.
about stage 5. I'd just like to hear what you have to say about it as well. It says that these rules won't just be about when and where you can go shopping, but restrictions on going shopping at all. Can you understand how that could be quite scary for Victorians to hear, and that would then encourage them to panic buy? And what do you mean by that?
No, I don't think so. I think I couldn't have been clearer today. I couldn't have been clearer yesterday that shopping centres remain open. And you don't need to go and buy 6 months' worth of groceries, and I'd ask people not to do that. We've made some changes in a number of different parts of the food industry, but they've been carefully calibrated. And again, you won't necessarily be able to buy everything that you might normally buy. You'll get pretty close. Quantities might be different. You might not be able to go and buy quite as much as you would normally buy, but we've worked very closely with industry to try and find that sweet spot where there's still everything we need, not necessarily everything we want. It is for a 6-week period. It's not 6 months. So I'd ask people just to work with us on that. And I know that all of our retail workers, all those supermarket workers, people working in distribution centres, cool stores, all of them, they're doing an amazing job to keep as much stock on the shelves as they possibly can. We don't make their job any easier if we go and buy 6 months' worth of supplies when we just don't need 6 months' worth of supplies. The reason stage 5 is mentioned is that there is no stage 5. This has to work. Otherwise, we will have to devise a set of rules that will even further limit people's movement. I don't want to get to a situation where we've got to take those steps. And that's not about, you can be polite and not talk about those matters, but that's not the way that I operate. I'm being frank. I'm being direct. I'm making it clear to people. We all have to follow these rules. We all have to accept that this is the reality that we are now confronted by. We've got to make this work because it's at best uncertain what the next steps would be. So this is where we find ourselves. And we've all got to focus on getting to the other side. And all of us can make contributions, large and small, but be in no doubt, all of us must make that contribution. And that's why Victoria Police will be out there in force. And the time for warnings, the time for, cutting people slack. If you've had a test, you need to be at home waiting for the result. If you've tested positive, you've got to be at home. If you're a close contact, you've got to be at home. The curfew is there for a reason. Needs to be followed. And if you think that it's a smart thing to test police, to try your luck, visiting a mate, well, we'll wait and see what the odds on that are, because Victoria Police and the ADF and others are out there, and I'll have more to say about penalties and more to say about enforcement tomorrow. Again, please, no one who's doing the right thing should see that as taking away from the work you're doing. I'm deeply, deeply grateful. But I think those people, particularly those Victorians, the vast majority who are doing the right thing, are becoming, like me, increasingly frustrated with people who aren't. And that's why we ask you to make the right choice, to make better choices, and frankly, given the odds of getting caught, make smarter choices. I'll have more to say about those issues tomorrow. Are there any other matters?
Just one, sorry.
Certainly. I shouldn't have said if they were a good place to end, should I?
The Assembly's not sitting tomorrow. Do you know if the council will be sitting?
I'm not sure. You've heard me say many times that I wouldn't seek to interpret the many riddles of that place. That's a matter for them. But the Chief Health Officer's advice is very clear. We don't want to do anything, any of us, to contribute to the spread of this, and particularly given when it comes to regional MPs, for instance, coming to Melbourne, there's not that kind of freedom of movement that was a feature earlier. But that's entirely a matter for the Legislative Council. Thanks very much, guys. See you tomorrow.